appointments. You've got to be a pretty good-sized employer yourself, at least in Iredell County, I guess. We talked earlier about the difficulty of finding good people. Is that getting to be a real issue for you?
Absolutely. We are one of the larger employers in Iredell County. We have about 1,550 employees at this time. And so we always have openings. We have somewhere between 60 and 100 openings at most times, which is difficult. When you're looking at 24/7 care and making sure that you're taking great care of the patient, you have to have enough bodies there to do it.
Mm-hmm.
And so that is a challenge for us. And there's a lot of ways that have changed. I think Joe mentioned it earlier. The world of applications has changed. The way that people find jobs has changed. You don't put an ad in the paper anymore. Now it's the internet, it's connections, and it's ways that you're going to go through LinkedIn and different aspects. And so a lot of what we do is more internet based than it used to be, and that is challenging for some folks. Especially the person who hasn't looked for a job in 30 years.
Right, right. Which could be very skilled at exactly what you're looking for. That connection is difficult. And, for you, it's interesting. I'm sitting here listening to you tell me the same problems that I hear in business all the time, and then I can't help but add to it, but you're actually saving lives, So it's not a restaurant where I might get a cold dinner, you know what I mean? So there is a bigger aspect to this.
Absolutely, and that's one of the challenges that we do face, and the goal is, how do we get the most effective level of care in there, and at the same time, be cost efficient. So it's a balancing act for us. We have to look, when can we, have enough staff? When do we look at what the staff person is doing, and is there somebody else that can do that for potentially less money, or because we can find them? It's just having the body, and sometimes you have to go out of the market and just bring that person in.
Mm-hmm. What I like to do is dig in a little bit on how you got to this position. So let's kind of back up a little bit, and let's talk just briefly about John Green. How did you get to this really big position that requires a lot of lives are based on some of the choices and decisions you make on a daily basis?
Well, it's nice of you to ask. Compared to Iredell Health System, I'm probably the least important part of it. But from my history, I went into school to become a healthcare provider. I went and I had a PT degree. So my first degree is in physical therapy, and I practiced physical therapy for several years. And so I had the opportunity and the honor of treating patients and helping them get better. And when you've done that, that helps you understand, hey, this is the bigger picture. The bigger picture is somebody that rolls in and walks out kind of an issue. And so I started as a physical therapist. I moved into a management role in physical therapy, and the rest just kind of fell into place. I was working at a hospital in Pittsburgh, and at the hospital, they had another individual leave. And when that individual left, they came to me and they said, hey, we need somebody to manage our physician practices in addition to rehab. Will you try it? And I did it. And then I moved to another hospital in Pittsburgh, and they said, we need somebody to be our vice president of clinical services and run the lab and the pharmacy and materials management. Will you do it? And I said, I'll do it. And then my wife said it's
on-the-job training is
it really was. I got my master's degree in business, toward the beginning of that process, so that made it a little easier.
Right.
And then my wife wanted to get a little warmer, so North Carolina, here we came.
Perfect.
Well,
now, you look like you don't look very old, but yet you've been in the health services for a while. The obvious question, and a lot of us see it all the time, but what are the kind of changes?
Where's the gray hair?
Seen?
Is that the obvious question you're going to ask?
No. I was pointing out that he's been in it long enough to probably seen a ton of change go on in the health system and health care. I know we could probably talk a few hours on that, but if you were just to clip the top of the waves, what comes to mind?
Well, the biggest challenge is the financial pressures. The financial pressures that you have when you look at the insurance industry and you look at where Medicare has gone, where Medicaid has gone, Medicaid expansion not occurring in North Carolina, the requirement to have insurance, but also the understanding that this insurance has really been put on the person's back. And so it's one thing to say, yes, you have insurance. It's another thing for that individual to not really fully understand there's a $5,000 amount that you're paying up front. Mm-hmm. I mean, most people don't have $5,000 in their pocket, which is why I haven't paid Harold back yet, by the way.
Right.
But that's a huge change. And so we've gone from a system where, really the insurance payment helped a hospital be viable operationally to a system that really is not.
John, I'm curious. How do we get the patient and the doctor together without so many people in between them? Because anytime I talk to insurance professionals, that's what they say. They say, anytime we have I can't remember his name, Wayne, but he's just really good at insurance analysis, and he talks about this often, that the solutions always keep adding people in between the doctor and the patient. Is there a way to solve this? Do you got a magic wand?
I left my magic wand back at the hospital. But there actually is. There are ways to solve it. And really one of the ways to solve it is getting all those people in the room and talking through the process. And we're working on that. Actually, right now we are doing that. We are working in different groups. One, we have a project going on with our cardiologists where we're working with the cardiologists and the hospital staff and saying, how do we make a better cath lab? How do we make this process work smoother, better? We're doing the same thing with our joint replacement patients. So our orthopedic surgeons are taking time out of their day and their month to come to a meeting and sit and say, what's a better way to do this? How can we change what we've done? We've done it this way for 10 years or 20 years or 5 years. There's probably a better, smarter way to do it. Let's talk. And when you start throwing ideas out, when you putting the spaghetti against the wall, something's going to stick. And as that happens, that absolutely is showing the potential for progress. We are looking at doing that on a bigger scale. The key is we absolutely need, you hit the nail on the head. The physician has to be in the room with the clinical staff who are there on the daily basis. I can sit and give questions and give advice, but I'm not the one, at 2 a.m. that's helping that patient. That's who I need to tell me what's the best way to do this, because they know much better.
Right.
One change that has to be big, even in your tenure there, has to be the technology changes and improvements. On the one hand, they're very, very expensive. On the other hand, they're very, very efficient, and you can do a lot more things. What's the trade-off there, do you think?
Well, it's funny. There's a couple trade-offs. One of the challenges you have is, in America, we expect technology now, and we expect it to be able to be treated yesterday. And so we do have the requirement that if we're going to keep folks in our community, and we want to do that, we feel that we are the provider of choice for this community, and there's good reason that people can get their health care here. But we then have to spend the money to show them that they can. So that's an important aspect. Secondly, if diagnostically these devices end up giving us better results, we need that. We want that. From a community standpoint, if my mom, my friend, my relatives come into this facility, I want them to have the best care possible with the best equipment.
It's interesting because listening to you talk, again, we forget sometimes that healthcare is a business. You have competition. I don't have to come to your facility. Talk about that, because I see it all the time, this sort of respectful, friendly competition between different facilities. Talk about that just a little bit for us small business people that are out there listening.
I think in many ways it's no different than in any other industry. There are times when it doesn't matter what facility it is. If it's an emergent issue, you're going to go to the closest facility, and that's where you should go. Other than that, though, you are going to be driven by a lot of things. One is your relationship with your physician. That's probably one of the biggest things, because that physician is, the captain of the ship. He's the person, or she's the person that's telling you, hey, this is what you need and when you need it. And that's very important. Secondly, though, is you're going to look at the quality of the organization, and you're going to look, and online you can find anything anymore. We all know that.
Sure.
So at midnight, I can sit there online and I can say, hey, listen, I see that Iredell has an A in this grade or has a B in this grade, and that's going to mean something. And again, as we go back to that individual who has to put money out of their pocket first, I guarantee you they're looking at something like that, and if not, they should be.
Right. One of the things I find to be very difficult, my son's got a kidney disorder, and we know at some point in his life he's going to need a kidney transplant, and we certainly hope later than now. But getting second opinions is such a challenge. Why is that? Because, normally in any other industry, I can pick up the phone and they'll be more than happy to tell me what they think and make fun of Wayne's opinion on how to solve this problem, right? But in this industry, they're very uncomfortable with that. Why is that?
I think it's just the collegial aspect of how folks were trained in this industry. We were trained in groups. You were trained in sessions together. And so I do believe that frequently there is a collegial respect that just makes people a little more concerned about that. Now, it doesn't mean you can't do it, and a lot of that is just setting the table the right way, just contacting that second physician and saying, hey, listen, I'm very comfortable with what Joe's already told me, but,
Sure.
to be the best individual and to make sure my care is the best it can be, I want to go check with you, Wayne.
Well, I mean, it is my son, so I do get a second opinion if I'm buying a car, or even
Absolutely.
a car repair. So it makes sense to me to try and do that,
And I agree. I think to be upfront and just say why you're there, it's not a distrust or a lack of concern about the other physician. That's going to go a long way.
Right. Interesting. What have we not brought up that people listening you'd like for them to know, whether it's small business or other?
Sure. I mean, I think from our perspective, we're always continuing to try to grow. From a community aspect, we do believe we're a strong part of this community. We're a nonprofit organization, which a lot of people don't recognize, but we are. I'm sure we're the largest nonprofit organization in this county based on that. And we've been here for 60 plus years. And our goal, the founders of Iredell Memorial Hospital back in 1952 wrote that, the community wellness was an important aspect of Iredell, which is really ahead of their time. If you think to 1952, there was not a lot of worry about wellness. There was obviously different types of food, there was different types of aspects towards smoking, but, we thought ahead to that. And so we've lived that for the last 60 plus years, and we're continuing to try to drive out into the community with our needs because we recognize one size doesn't fit all. The individual really doesn't want to always have to come to the corner of Brookdale and Hartness. We're happy to see you there, but at the same time, it's not always convenient. You guys both drove here on roads that weren't the easiest to drive here on. If I can have different providers and different services in Mooresville or in Moxville or in Harmony or in Alexander County and Taylorsville, which we have, that's really an important aspect of where Iredell Health System's going, because to care for the whole community, that really is an important aspect of what we want to do.
How do you decide where these, I would call them satellite locations, I don't know what you would call them, but how do you decide where to place those? Because for us in small business, the demographics, the strategy of that is very challenging to do.
And I would say it's the same. We have strategy, we look at the demographics, we look at need, so we're going to look at a community. Using Mooresville as an easy example, Mooresville is a absolutely, expanding community. And from our perspective, we have some physicians down there, we have some services, but we could have more. We recognize that the individual that lives near Exit 36 can drive up to Statesville and drive to Iredell Memorial Hospital as easy as driving down towards Charlotte. They can't get even close to Charlotte in the amount of time that they're going to get to our place. Mm-hmm. And so it's, some of it's just looking and saying demographically makes sense to be there. Then you have to look at, just like in small business, you're looking at traffic counts, you're looking at just the reality of what you can afford.
Do you move these satellites to where the doctors are, or do you try and promote and move the doctors to where you absolutely need the facilities? How does that work?
It's going to be a combination of both, actually. If you're looking to purchase a physician who's already in place and is well established, you're going to leave them there because that's where people are comfortable. If you're looking at a new physician or a new provider source, then you're going to look to say, hey, where's a place that I need to have? Where's somebody that is underserved comparatively? So it's a little bit of a combination. It's a challenge for us on an ongoing basis, but it's a good challenge to have.
Just one more thing for you to add to your list to be responsible for.
Happy to do it.
Thank you, my friend. We really do appreciate you taking the time to talk with us.